Hello, everybody. Thank you so much for joining this guided imagery for menopause series, where today is the first of 4 webinars that we will host this month. In this first webinar, we will be spending time understanding the power of guided imagery and the benefits that can be realized. I know that when I take the time to practice this, I'm not only more relaxed, but also have that I feel stronger and have a real sense of joy. My name's Kim Fancher, and I will be your host today. And we here at Positive Health are so honored to be able to bring experts in to share some really great information on menopause topics like this one that are important to you. So now, without further ado, let's go ahead and get this kicked off. And I am so thrilled to introduce our guest presenter, Jane Ehrman, who is a mind-body medicine and behavioral health specialist. And we are very grateful that she is able to share with us some insights on how to use guided imagery to improve health and well-being during your menopause journey. Hi, Jane. How are you today?
I'm well, Kim. I'm delighted to be here.
Awesome. Well, would you like to start out with just telling us a little bit more about yourself?
Sure. I was a practitioner at the Cleveland Clinic in the Center for Integrative and Preventative Medicine for 16 years and retired just a few years ago. I came to this work because of the profound impact that mind-body practices had for me when I was in treatment and recovery for breast cancer and forced menopause when I was 37. And so my mission is to help people to recognize and to tap into their inner resources, because the power to do this work and to do it effectively is in us, so that they can tap into these resources for greater health and for personal development. So I'm just delighted to be here to do this with everyone today. With that, let's get started. So we're going to talk today just an overview of what guided imagery is, the science behind it, and the benefits that you can experience from this. What happened to my... All of a sudden I've lost the... Oh, there we go. Okay, so it's about your imagination. It's an important part of who you are, and we use our imagination all the time to create, to problem solve, to heal and recover, and to change behavior. So today we're going to be talking about using your imagination, something we develop in childhood, but it's not just for kids, it's for all of us. We're always using our imagination. So the mind body is highly integrated. The mind can influence our health for better or for worse. Our thoughts, what's going on in our mind, can raise and lower our blood pressure, change our heart rate, change our breathing, increase or decrease pain, and other sensations that are going on in the body. Imagery is using your mind in a positive way to participate in your health and healing of your body and mind. When you're physically not feeling well, that also impacts your mood and how you think and how you behave. And it affects your spirit. Sometimes we feel a sense of burden, a heavy-heartedness when we don't feel well. So we are highly integrated, body, mind, and life force energy. So what is guided imagery? It's purposeful daydreaming. It's using your imagination at its best. You know how to use your imagination, or you've often used it maybe to scare yourself or to worry, but this is about using it in a positive way. It's about using all of your senses to some degree. It's a natural way we process our thoughts. When someone is talking with you and telling you about this amazing vacation that they were on, you start to imagine what the beach was like and what the weather was like there. You start to imagine as a way of processing what you're hearing. And it's also called visualization. I don't use the term visualization very much because it isn't just visual. So when we're using our imagination, some people are quite visual. They see the waves on the in the ocean, or they see the forest. But for many people, it isn't so much seeing it, but they smell the fresh air and they feel what it feels like when they're there, and they hear the sounds of nature. So it's really about all the senses. So imagery is sensory based. It's visual, it's auditory, what we hear. It's kinesthetic, how we feel as though we're there. It's tactile. We can touch things. We can feel the softness of a breeze. It's olfactory, so it's hearing or it's tasting. I remember working with an 87-year-old woman who imagined she was in a patch of blueberry shrubs, and she could taste and smell the freshness of the blueberries. It was amazing. So that's all right brain activity. It's not a thinking process. There is no sensation for the letter B or the number 12. Do you feel anything when you think of those two things? No. Those are verbal and mathematic. That's left brain. So this is about using your right brain. So here's some of the power of imagery. The mind isn't able to tell the difference between what is happening in real time around you and the imagined thoughts and experiences that you're focusing on. The mind believes everything is real. For instance, if you're sitting in a beautiful place in nature, it's peaceful, it's beautiful, but you're thinking about your credit card bill that you're not sure you're going to be able to pay this month, and you start feeling ramped up and stressed about that, you're in a beautiful place. None of this is happening here, but your mind believes you're in credit card land and you're in trouble. So that's important to understand. And when we recall or imagine something positive, we feel positive. So you can be in a chaotic situation, but if you're reliving or recalling a wonderful experience or something for which you're grateful, you start to feel better, even though what's going on around you is chaotic. When we recall or imagine something that's upsetting, we feel physically and emotionally upset. So this is important to understand. And what we imagine lights up neuromuscular pathways in the body, the nerves and the muscles. So this is something I often use with athletes or with performers or even before academic exams, because when you're imagining doing the skill just right with excellence, it lights up the nerves and muscle pathways for that skill, and you're at least 20% more likely to perform that skill accurately. So our thoughts and emotions affect the chemistry of our cells and the function of our organ systems. That's pretty crazy, isn't it? Good stuff. Now, your imagination and using imagery can have impact on the immune system. When we're in high stress, we have as much as a 30% drop in the number of powerful immune cells that can protect us from illness or injury or anything like that. So that's how we usually end up coming down with some kind of an illness, is when our immune system isn't functioning well. Now, this picture on the left, that orange circle you see there, cell, that's not the best color, but it is a red blood cell. And that filmy a substance underneath it is a macrophage. It's an immune cell. That immune cell is going to pull in that red cell and read it. And if it's under 120 days and it's not healthy, it's going to get rid of it in your body. It's going to clear it out of your system. But if it's normal and healthy, it'll spit it back out and let it do its work. That's pretty profound stuff. On the right, in the lower white quadrant, you see a bacterium. Now, it could be a bacterium that's very helpful in your digestive system, or it could be something harmful that would cause you to get sick. That green piece up there, the tissue up there, that is a macrophage. They're all on a petri dish, and the macrophage is stained green. They put them apart on one side of the petri dish and the bacterium on the other. And what happens is that macrophage recognizes, well, that's a bacterium. It's intelligent. These cells in your immune system are highly intelligent. It sees it, it's reaching out for it. It's going to grab it and pull it into itself and read it. And if it's a helpful bacterium, it'll let it go and let it be. But if it's harmful, it will take it into itself and it will remove it from your body. That's powerful. It's almost like Star Wars to me. But this is going on in our body all the time. And our immune system is always paying attention to what's going on in our whole system, what's going on in the internal environment, and it's affected by that. So let's talk about using imagery. Here are all the kinds of ways it can be used to improve performance. For people that are struggling with test anxiety, they know all the information, but they get into an exam and they can't remember anything, partly because they're so stressed they're not even breathing well. So they're not getting as good a amount of oxygen to their brain, and their brain isn't functioning with great clarity because they're stressed. But when you use imagery and imagine yourself confident, knowing the information and clearing everything out, you're able to perform on that exam much better. So we've used it for years in academics, in athletics, elite athletes. You see them walking through the tunnel to the locker room, and they have their AirPods in, and they're kind of zoned out, or they have a headset on. They're doing their program, their imagery of being focused, present, grounded, and ready to go do their performance. They're letting everything else go away. They're getting themselves into the zone. The same thing with expressive arts and public speaking. It's also used to improve your productivity. It's a great way to problem solve, to imagine the issue on all sides and all the possibilities for solutions, to improve creativity. How do you think we're doing things on the internet? Somebody was imagining this kind of capability and worked it through. It's also used very effectively for stress-related conditions like irritable bowel, recurrent headaches, anxiety, and post-traumatic stress. And again, used widely in treatment and recovery from cancer, for surgery and medical procedures, to reduce treatment side effects. I found that profoundly helpful. To speed healing and recovery, there's groundbreaking research that shows just doing imagery once before surgery not only reduces the amount of anesthesia you need to get your body into that relaxed state, but also your immune system and your healing system is working much better. You can recover faster and more comfortably. Improves pain management, absolutely. Improves sleep and rebalances the immune system when it's out of balance. And it's also very effective in high-risk pregnancy and childbirthing. When women have hyperemesis, uncontrollable nausea and vomiting, particularly it's in the first trimester of pregnancy, but it can, for some women, carry on through the whole pregnancy. Guided imagery is very powerful in stopping that so that a woman can function better and get the rest and nutrition and exercise that they need. It's also very powerful for successful behavior change, for things like biting your nails or quitting smoking or changing other things. It's about going to that part of ourselves where those behaviors have been strengthened and developed and working to change them. So it's also very helpful for in pre-op, before surgery, to strengthen your inner locus of control. That means what you bring to the situation, your inner power, your confidence, your control. deeper relaxation, and rehearsal imagery, rehearsing just the way you want to go through that experience in a positive, empowered way. Too often we're worried about, I'm afraid this will happen and then that'll happen, and oh my gosh. And we're actually programming ourselves for the negative experience. This is about helping ourselves create just the right positive scenario for ourselves. And post-operatively, it's very effective to relieve pain, to stop nausea and vomiting that often occurs for some people because of the anesthetic that's used. It also helps to reduce risk of complications like bleeding, infection, tissue or device rejection, and speeds healing and recovery. This was very powerful research. It was groundbreaking research that showed how imagery could help in these ways. So we know from groundbreaking research at the Cleveland Clinic many years ago, and that's been replicated a number of times, that when your brain is in that state of peace and calm, your body restores its energy better and faster. You heal faster, and cells and tissues repair themselves faster. That people literally were able to go home from major abdominal surgery 2 days sooner, not because insurance said they couldn't stay at the hospital. They were able to go home because their bowel and bladder function returned to normal much more quickly because they had fewer complications, much less blood loss, better pain management, better energy, better comfort levels. So that's profound. My work in helping you in this journey of your menopause journey is to help you bring yourself, your brain, your mind to that state of peace and calm purposefully, effectively, and often to help you move through more comfortably in your journey. So guided imagery has shown well-established benefits in things like an angiogram, anxiety, asthma, back and neck pain, childbirth, again, high risk and normal pregnancy and delivery, coronary artery disease, diabetes, headaches, hypertension, high blood pressure, insomnia, irritable bowel, pre and post surgery to again reduce complications, faster healing, shorter hospital stay. It's very helpful for sinus pain and to stop smoking, to relieve stress and improve patient satisfaction, because this is the real patient satisfaction. It's not about how great the food is. It's about how you're able to function better in these difficult, challenging situations. So, practicing imagery. Here's the imagery process. Here's what we're going to be doing today. It's important to have your body be in a comfortable, well-supported position. So you may be sitting to do this. Maybe you're reclining or you're in a recliner going through this webinar today. Just be in a position that's comfortable. And you want to uncross your legs and feet. You want to just be stretched out comfortably and your arms relaxed, your head well supported. You'll be able to either gently close your eyes or lower your gaze, whatever is more comfortable for you. I'll invite you to center yourself with your breath, and then as you're paying attention to your breath, to shift your focus away from your physical surroundings, the room you're in, what's going on there, how the energy is in that room, and your thoughts. You know how you've been paying attention to this, and at the same time, you've had thoughts going all over the place, right? Because our mind is a lot like a 3-year-old and it likes to wander. So when it wanders, just bring it back without judgment, without getting all upset with yourself. Just bring your focus back. I would also, I don't know why that's up. Let's get that off there. I would also encourage you to have a few tissues with you, because sometimes this process is emotional. And for reasons, they could be happy tears, they could be sad tears, but you're connecting with the essence of who you are. It's like coming home to yourself. And so tears are very natural and normal. So just be aware of that. And sometimes having some tissues nearby can be helpful. And I'll be inviting you, and I never tell any people where to go. None of us like that. So I'll be inviting you to shift away from feeling and paying attention to your outer world, the room you're in, to your inner world, your imagination. And it's used to rehearse upcoming events. We won't be doing that today, but we will be experiencing a peaceful, calm place. And I'll invite you to connect with that. In some future sessions, you'll be invited to connect with your inner wisdom, the part of you that's wise, compassionate, loving, and has your back. The part of you that knows what's best to do. Sometimes we listen to that part and it makes sense. Sometimes we don't. And when we don't, later on, we realize, I knew that. Why didn't I do something about that? So these are the ways that it can be used. And I'll then invite you, when we're done with the imagery process, to focus back to your outer world and then to process the experience. What did you experience? How was that for you? What insights and information did you gain from that experience? How do you feel after the experience, after the guided imagery, compared to before? So again, let's prepare for the imagery. It's my cursor that's going around here. Sorry about that. When you do imagery on your own, or even now when we're doing it, it's important to choose a quiet place with as few interruptions as possible. That's people, pets. Pets gravitate to this stuff. So you want to, if you're at all able to, have the pets somewhere else, another part of your living experience. The phone, silence your phone, or anything else that will interrupt you. That's a really important one because oftentimes people are pretty connected to their phones. They don't want to miss anything, but this might be a good time to just quiet it or put it in another room for a short time. And when you do it on your own, you might want to set a timer. Maybe you only have 15 or 20 minutes. 20 minutes is it's a maximum amount of time to do imagery. So set a timer. And sometimes, especially if we're a little sleep deprived, we may fall asleep. And so setting that timer can be beneficial. And again, you want to sit or lie down, have your body comfortable and well supported so that you're also able to breathe comfortably. So wear comfortable clothing. All right, let's begin. You'll hear some music in the background. There's this scene here of a pathway. You can stare at that if you'd like, or gently close your eyes. Or you can lower your gaze. Whatever works for you. And before going right into guided imagery, it's helpful to set some intentions for this session. You can say them privately to yourself. You're invited to set the intention to take the path within yourself that knows just where to take you in your inner. Inviting yourself to go to a special healing place, perhaps in nature, where you feel peaceful and calm. You're invited also to set the intention that in that special place, you gain insight and information that supports your wellness and personal development. And so now you're invited to bring your attention to your breath. Breathe normally, comfortably, in and out of your nose. Your body has its own rhythm. Simply let each breath come and go naturally. Purposefully moving from breath to breath. Let yourself get more settled and comfortable. And anytime you notice your mind wandering, simply refocus to your breath without judgment. The mind naturally wanders. As you continue to breathe comfortably, I invite you to imagine stepping on the river path that takes you to your special healing place. It's a gentle slope, smooth, easy to go. As you slowly move along the path at your own pace, you move closer and closer to the complete stillness within. You're invited to move away from the human sense of your physical surroundings. You allow them to fade off into the distance for just this little while as you move closer and closer to the quiet stillness. As you continue to travel along the path, you notice up ahead that there is an open gate. And on the other side of the gate is your special healing place. This path knows just exactly what to have on the other side of the gate for you. As you reach the gate, stop and take a cleansing breath. And then go through the gate in slow. When you get there, with your senses, notice your surroundings. Where are you? It may be a place you know and have been to, or maybe a new place. You're invited to take in your surroundings. Notice the scenery around you. Notice the time of day. And what the temperature feels. You may notice the sounds of nature. And how the air here smells and feels. Perhaps there's a freshness or even a fragrance in the air. If you haven't already, choose a place here to stretch out and just be. Experience image, taking a long breath. This is your special healing place. A place to release no longer suits. A place just for you to restore your energy. a place to help you navigate this significant part of your life journey more positively, more comfortably, more effectively, and empowered. How you feel being here? Perhaps comfortable, peaceful, calm, confident. That is what is healing about. We provide renewing positive energy. It is a place to release depleting negative. You're invited to take in the renewing energy that you experience. The peace, calm, life-giving energy that is here for you. You might imagine this energy like a shower of energy that moves over and through you. This energy may have colors to it, or a softness and coolness, or something else. Notice what you experience about this shower of renewing energy. Imagine this energy washing away tension, any fatigue, unhelpful thoughts, uncomfortable feelings that you notice in different parts of your body. Anything that depletes your energy. Breathe it away. Let the breeze carry it off and away. Let it drip from fingers and toes to Mother Earth, or perhaps to a nearby stream of water or shoreline, to carry it off and away. And don't mind to bring it. Take some moments to clear away what no longer serves you. Notice that you may feel a little lighter, a little comfortable in the places that you clear out. Now imagine this shower of energy soaking into the cleared spaces, soothing, healing, comforting, calming all the cells of your being. And simply rest in this wonderful energy. You can re-experience the energy of your special healing place, creating an anchor action. It's a simple, subtle action coupled with a cleansing breath It reactivates the peace, calm, and comfort here. The anchor action for your special healing place is to bring a finger and thumb on the same hand together and take a cleansing breath and tap into special healing place energy. So do them. Bring one of your fingers and thumb, same hand together. Take a cleansing breath and experience the healing energy here. Peace, calm, comfort. Feel that energy even stronger by taking more comfortable breaths, strengthening that action as you need it. See how that is? Now, a little practice. Release your thumb and finger and bring your mind to something that causes you to feel stressed or tense. Nothing great big. But allow yourself to feel the tension and uneasiness of that experience or place or person or situation, whatever. When you feel that uncomfortableness, breathe into it. Make it a little strong. Now bring your thumb and finger together. Take a cleansing breath, tapping into healing energy in your special place. Breathe it in. Take more breaths, comfortably breathing it in, strengthening it. Notice how you feel. Calmer, more comfortable. You can tell yourself it gets better with practice. And you're invited to practice it even when you don't need it, to strengthen this skill so that it's there when you do need it. You're invited to tell yourself, the more I practice my anchor energy, the more easily and effectively I calm myself. You're invited to bring your focus back to this special healing place and ask yourself, what gifts did this place have for me today? And how can this healing place help me when I'm stressed, feeling drained or overwhelmed? You're invited to take a moment and decide when you will come back here on your own to help yourself heal. This place is always available to you. It's like a screen at the back of your mind, just a thought and breath away. A place for you to come to and renew your energy. Before you head back to the gate, you're invited to privately thank this place for its gifts to you today. And as you journey back through the gates to your path, bring with you insights and information from your inner work today, along with your anchor action and all the renewing energy of your special healing place. And as you walk on the path, back to your outer world. Allow yourself to become more awake, refreshed. Gently wiggle and stretch fingers and toes, clear-headed and alert. Gently open your eyes. And notice how you feel now compared to before the imagery. What can you share? These are some of the benefits when we're in a meditative state. Physical relaxation, less pain, more comfort. Your immune system rebalances into the right numbers. Mental quiet and calm, a sense of strength and awareness. Often joy, love, gratitude, a sense of timeless, boundless, infinite energy. The sense that you've only been doing this a few moments, and yet it was a good 16 minutes. So with that, I welcome your questions and comments. What did you find most interesting about this or helpful? What questions do you have?
Well, Jane, thank you so much for all that. Um, it's always amazing to me how our bodies work to protect us, truly a miracle and sometimes very sci-fi feeling, as you mentioned. And then, when you add that bit of guided imagery to your day, to help with some unwanted symptoms that you may be experiencing,
Right.
that really becomes so wonderful and powerful.
Yes.
Yeah, I really truly felt like I was somewhere else for that bit of moment.
Well, you were.
Yeah.
Yes. And I'm looking forward in the next session to teach how using your breath and the imagery, you can dissipate a hot flash and use these practices to reduce the frequency and intensity and duration of hot flashes.
Oh, that would be so helpful for many, including
Yes,
myself.
absolutely.
Yeah. Yeah. We have a lot on us, women take on so much, and during that stage of menopause, there's generally added responsibilities and things that are in and out of our lives, and it's good to just take that time for ourselves, just to relax, reflect, and really kind of set where we want to be going forward.
Yes, because this is a part of a journey that is unknown to so many of us, and there hasn't been a great amount of support. And positive health is a true gem for those issues. And so sometimes when we are worried about the unknowns, how long is, am I going to have a hot flash in the middle of this meeting, or how long is this going to last? That can ramp up the anxiety and stress. And to have these tools to help us lovingly pull ourselves by the back of the shirt and calm ourselves rather than go over the cliff can be very helpful. Yeah.
I don't see any questions or comments in the chat as of yet, but
Okay.
I guess something that comes to mind for me is um, frequency. So I know everybody, their situation is unique, and so everyone's going to have their own time to do something like this. But what is the overall recommended frequency of using this type of practice?
Kim, that's a great question. And also, what goes along with that is so often as women, we put ourselves so far down on the list, or we're not even on the list. So we keep saying we don't have time to do this. 20 minutes is optimal, but anywhere from 10 to 15 minutes And we can make space for that. It's important to do that. It can be very effective in that amount of time. And when you are stressed and in the middle of a difficult situation, your breath is always there. Your imagination is always there. You can be in a meeting and imagine you're breathing in your special healing place.
Mm-hmm.
So you can do that in moments. It just takes practice. I would suggest 10, 15 minutes, maybe 2 or 3 times a week to start. And then build up from that to 4 times a week, 5 times a week. Ideally, wouldn't it be wonderful to do it every day? But let go of that perfection stuff. If I don't do it every day, then I can't do it. It's all that all or nothing thinking is very unhelpful to us. And so many of us women get caught up in that because we are trying to juggle so many things and feel such responsibility. So a way to look at this is it's just like being on a jet and they say, if the air pressure changes, you need to put your mask on first before you can help anyone else. Guided imagery is putting the mask on for yourself so that you can function better in all the things that you're trying to get done.
Makes sense. Is there a best time of the day to do a session?
Whatever time of day works for you. At this point in my life, well, now that I have a puppy, mornings generally very good, but he really wants to play. So for people who are very busy in the morning, that's not the best time. Maybe taking part of their lunchtime or right after coming home or early evening or just before bed. Choose a time that works with your schedule. And it may vary day to day or week to week. Be flexible with that. But the more important thing is do it when you're able to do it, as opposed to cramming it somewhere where it's not going to fit.
Any suggestions on what I can do to remember to take a breath and do a quick session?
Post-it notes can be very helpful to put places, maybe on your mirror when you're getting ready in the morning, in the bathroom, to just stop and breathe. Stop and breathe slowly and deeply. I used to hand out when I would do sessions with people live in person, little blue dots. You can get them at office supply stores, the little blue dots that you could put on files or whatever. I put those blue dots places to remind myself to just breathe. And you might want to put them on the foreheads of some people in your life, but it's better to just imagine them there. So there are some people in our lives that when we see them, we just need to breathe.
That's good. Good advice. Can guided imagery help with my motivation to take steps around a healthy lifestyle that will then help with my menopause symptoms?
Oh, that's a great question. Yes. One of the ways that guided imagery can be motivating is to rehearse how you're going to go through a situation. So if you're going to be out to dinner with friends and you know that there's a tendency that when, somebody decides to order something that is the least healthy thing on the menu, then everybody else kind of goes along with it because, you all want to fit in. And you know that that's going to be the worst thing for you. Always, of course, check the menu if possible before you go, but then set the tone for yourself. Imagine yourself as Wonder Woman standing in your power and reminding yourself of how you want to be out in the future, imagining yourself healthier, feeling stronger, more energized, more confident, more centered and clear thinking and grounded in what is best for you, regardless of what everybody else is doing, right? And so maybe you say, hey, can I order first? And, excuse yourself to the bathroom. And while you're there, just focus on strengthening yourself. Just imagine yourself doing the best you can. Power words for yourself. I am confident. I make the best decisions for me. I take care of my health. I'm responsible. for my choices, and I make my best choices. Those kinds of things. So it's using the imagery and talking to yourself in positive, powerful ways. Does that make any sense?
It certainly does. Well, I don't think we have any other questions, and I would like to take a few moments here to provide some announcements to our listeners out there. Okay, great. We hope that you can join us for more webinars in the future. We here at Positive Health are leveraging the power of webinars and podcasts to help build awareness on many important menopause-related topics. So here again, throughout this month of July, we have Jane joining us weekly to build up on this whole series of guided imagery in menopause. So our next one is next Tuesday, the 16th, same time at 12 p.m. Eastern time. So be sure to join in on that and the other two remaining throughout the month of July. And then on July 31st, we have Skylar Grissel coming back to talk to us about Yoga Nidra meditation. And as a mindfulness mentor, she's providing this monthly series of webinars for us to help us understand how we can use mindfulness to improve some of our symptoms. So all these you can find at our positivehealth.com/webinar site. And then we have a new podcast that was just released. I'm so excited to have Roma Valentine as a guest, and she talked about, being centered and grounded and joyful with Ayurveda. So if you want to learn more about that, please don't hesitate to go listen to her podcast episode at our positivehealth.com/podcast site, or you can find it at any of your other favorite channels that you have: Amazon, Apple, Spotify, and iHeartRadio. And then I'd also like to mention that, maybe you are a member of our Positive Health program, or someone who could possibly benefit from this program. Anyone can sign up at positivehealth.com/membership, where they can really take some steps to make the change for the better and join our pilot program that is free until December 31st this year. And then lastly, I'd like to mention we have a menopause journey community out there where people can just join in and listen to hear what other people are saying about their symptoms, or learn about some new resources that are available to help folks with their journey. So you can become a member of that menopause journey community by just sending an email to info@positivehealth.com, and we'll get you started with that. And I believe that wraps it up, Jane, with our last thank you slide. And I do really want to thank you so much for this great presentation. You provided some wonderful insights that were valuable to me, definitely, and hope to our audience as well.
Thank you, Kim. Thank you for having me.
Well, thank you. And I hope everyone has a wonderful day.
Yes.